Imagine this. You're assisting in theater. Everything is running smoothly. Suddenly, a sharp, insistent buzzing pierces the air. Your heart pounds. The surgical team freezes. This is it, an emergency. As an operating department practitioner, you are a vital part of the theater team. You are trained to handle these critical moments. Emergencies are rare, but being prepared is crucial. Your quick thinking and actions can make a real difference. Remember, stay calm, stay focused, and trust your training. You've got this. Emergencies rarely happen out of the blue. In the operating theater, things can change in an instant. But more often than not, there are subtle clues that something isn't quite right. Being able to recognize these early warning signs can make all the difference between a smooth recovery and a critical situation. Often, there are warning signs. These signs might be easy to miss if you're not paying close attention, but with experience and vigilance, you'll start to notice the patterns that precede trouble. It's like a storm brewing. Sometimes you can sense the tension in the air before anything actually happens. Just as you might see dark clouds gathering before a heavy rain, you can often spot the subtle changes in a patient's condition before a full-blown emergency strikes. As an ODP, your role is to be constantly alert, scanning the monitors, the patient, and the team for any signs that something is amiss. Your vigilance is the first line of defense against complications. For example, a sudden drop in blood pressure can be an early indicator that the patient is losing blood or reacting poorly to medication. It's a sign that demands immediate attention and action. A patient's oxygen saturation falling is another critical warning. Even a small decrease can signal that the patient's airway is compromised or that their lungs aren't working as they should. The end tidal CO2 reading changing can indicate problems with ventilation or circulation. It's a vital clue that something deeper may be going wrong, and it's up to you to spot it quickly. An irregular heartbeat or arrhythmia might be the first sign of a cardiac event. Recognizing this early can give the team precious time to intervene and prevent further complications. A sudden allergic reaction, known as anaphylaxis, can escalate rapidly. Swelling, rash, or a sudden drop in blood pressure are all signs that require immediate action to protect the patient's life. These are all red flags, signals that something is wrong, and that the team needs to respond without delay. If you notice any of these signs, don't hesitate to speak up. Early recognition and clear communication are absolutely key. By acting quickly and decisively, you can help prevent a minor issue from becoming a major emergency, ensuring the best possible outcome for your patient and your team. A cardiac arrest is a life-threatening emergency that can occur suddenly and without warning, even in the most controlled environments like an operating theater. In these critical moments, every second counts, and the actions of the surgical team can mean the difference between life and death. The atmosphere instantly shifts from routine to urgent, and it's essential that everyone knows their role and responds without hesitation. When a patient's heart stops beating effectively, blood flow to the brain and vital organs ceases, and they stop breathing. The monitor may show a flat line or abnormal rhythm, and the patient becomes unresponsive. This is a true medical emergency that demands immediate, coordinated intervention from the entire team. In this situation, the team must act quickly and efficiently. Each member has a specific responsibility, and clear communication is vital. The lead surgeon or anesthetist may take charge, but everyone's input and actions are crucial to the patient's survival. As an operating department practitioner, or ODP, your training prepares you to respond decisively. The first step is to call for help. Activate the emergency alarm or shout for assistance so that additional support arrives as quickly as possible. Time is of the essence, and getting more hands on deck can make all the difference. Shout "cardiac arrest" loudly and clearly to alert everyone in the room. This ensures that all team members are immediately aware of the situation and can switch to emergency protocols without delay. Begin CPR without hesitation. High-quality chest compressions and rescue breaths are essential to maintain circulation and oxygenation until the heart can be restarted. Make sure compressions are deep and at the correct rate, and that breaths are delivered effectively. Rotate compressors regularly to prevent fatigue and maintain the quality of CPR. Ensure the oxygen mask is securely in place and that the patient is receiving 100% oxygen. The anesthetist may manage the airway, but as an ODP, you play a key role in supporting ventilation and monitoring the patient's response. Assist with attaching the defibrillator pads promptly. Make sure they are placed correctly on the patient's chest, as this is critical for effective defibrillation. Be ready to operate the defibrillator or follow instructions from the team leader. Prepare and administer emergency drugs as directed, such as adrenaline or amiodarone. Double-check dosages and routes and communicate clearly with the team to avoid any errors during this high-pressure situation. Throughout the crisis, it's vital to document every action taken and the exact timings. Accurate records help guide ongoing treatment and are essential for post-event review. Assign someone to keep track of interventions, medications, and changes in the patient's condition. Your quick thinking, calm demeanor, and decisive actions as an ODP can truly be life-saving. By working together as a team and following established protocols, you give your patient the best possible chance of survival during a cardiac arrest in the operating theater. Anaphylaxis is a severe allergic reaction. It can be triggered by anything from medications to latex gloves. Unlike a dramatic cardiac arrest, anaphylaxis can be silent and swift. As an ODP, you play a crucial supporting role. Know the signs: swelling, rash, difficulty breathing, a drop in blood pressure. Be prepared to act fast. This includes drawing up emergency medication, particularly adrenaline, and having airway management equipment ready. Your awareness and prompt actions are vital in supporting the team and stabilizing the patient. In today's operating theaters, we rely more than ever on a wide range of sophisticated technology. From anesthetic machines and ventilators to monitors and surgical tools, every piece of equipment plays a crucial role in ensuring patient safety and supporting the surgical team. This technology allows us to perform complex procedures with greater precision and efficiency, but it also means that we are dependent on everything working as it should. But what happens when a vital piece of equipment suddenly fails in the middle of a procedure? The first and most important thing to remember is, don't panic. Equipment failure can be stressful, but staying calm is essential for patient safety and for leading your team through the situation. This is exactly where your training and preparation come into play. You've practiced these scenarios and you know the protocols. Trust in your skills and your ability to respond quickly and effectively. The first step is to try to identify the source of the problem. Is the equipment completely unresponsive, or is it showing error messages? Are there any unusual sounds or smells? Quickly but methodically check the device and its connections. Ask yourself, is it a simple power issue such as a loose plug or a tripped circuit breaker? Or could it be a mechanical failure like a jammed component or a broken part? Sometimes the solution is as straightforward as reconnecting a cable or replacing a fuse. While one team member contacts the technical support team or biomedical engineers for immediate assistance, others should be ready to implement backup plans. This might mean switching to manual methods or using alternative equipment that's available in the theater. For example, if the ventilator fails, you may need to assist the patient's breathing manually using a bag valve mask. This is a critical skill, and being able to perform it confidently can make all the difference in an emergency. Ultimately, your ability to adapt, communicate clearly with your team, and think on your feet is absolutely essential. By staying composed and following your training, you can help ensure the best possible outcome for your patient, even in the face of unexpected equipment failure. Imagine a busy kitchen. Everyone's rushing around, but the head chef directs the team with clear instructions, ensuring a perfectly cooked meal. The operating theater during an emergency is similar. Clear, concise communication is crucial. Use the patient's name, state the problem clearly, and confirm instructions using closed-loop communication. For example, John's oxygen saturation is dropping. I'm going to increase the oxygen flow to 10 liters, doctor. Is that correct? This ensures everyone is on the same page and really reduces the risk of errors. The emergency has been handled. The patient is stable. Take a deep breath, you did it. But your job isn't done yet. Help the team stabilize the patient fully and transfer them to recovery. Restock any used equipment and check that everything is in working order. Complete the necessary incident reports, accurately documenting the events. And finally, participate in the team debrief. This is a chance to discuss what went well, what could be improved, and learn from the experience. Working as an ODP in the operating theater is a challenging but incredibly rewarding role. You are a vital part of the team, and your actions can truly make a difference in life or death situations. Remember, early recognition is key. Stay vigilant and be aware of the warning signs of an emergency. When a crisis hits, stay calm, trust your training, and communicate clearly. By working together as a team, we can overcome any challenge and ensure the best possible outcome for our patients.